The financial report is commonly generated at the end of the month. If required, this can also be utilized each week for the doctors or at the end of each quarter or financial year for your bookkeeper or accountant. This report shows when the invoice was created, the GST amounts, payments made and allocated to an invoice, any refunds issued, item fee adjustments, and voided invoices. It is important to understand that deposits taken will not appear in this financial report until an invoice has been issued and deposit allocated to the said invoice. The financial report can be generated by provider and site of service. You can then set the required date range or simply select the time period from the 3 dots menu. Within the report, you can click on the drop-down arrow to the left of each row to review more details. If details are cut off, such as the patient's name or transaction description, simply hover your mouse over the text and a tooltip will appear with the full details. Any transactions that are shown in grey indicate that the specific transaction falls outside of the report's date range. These are simply listed here to provide context when reviewing the specific transactions. The values of these grey text lines will not be included in the overall totals for this date range. To save a copy of this report for your doctor, bookkeeper, or accountant, simply click on the Export button found in the top right. And within the Export button, there are 2 options, Invoice Report and Item Level Report. Once you select the report, this will export to a CSV file, which can be opened in Microsoft Excel. Invoice report will show a clear list of invoice and pay transactions based on the criteria that was set in Gentu. The columns found in this report are the same as those seen in Gentu. Whereas the item level report will show a breakdown of item numbers invoiced per patient and the corresponding payments on a subsequent line. The financial report is more detailed. That includes invoiced, GST amounts, payments, refunds, item fee adjustments, and any voided items. Your bookkeeper or accountant can then utilize these spreadsheets